In this video, we're comparing herpes to vaginal yeast infection, and the person should learn how to differentiate between those two conditions, how to tell the difference between herpes, genital herpes, and vaginal yeast infection. My name is Slava Fuzailov, and I'm a physician at STD Center, New York, one of the biggest and busiest STD centers in New York City, Midtown Manhattan. Why are we recording this video? Both conditions are common conditions, genital herpes and vaginal yeast infection. They can affect females or people with vagina of different ages. Both conditions can look alike when they're presented, and people want to know the difference and how to tell the difference. And unlike vaginal yeast infection, herpes infection has a lot of stigma and misconception. And besides stigma and misconception, herpes can be easily passed to the partner, and it's not a curable condition. And I'm going to record a separate video on misconception and stigma of the herpes. So how doctors can tell the difference between those two conditions, herpes and genital herpes and vaginal yeast infection? We usually consider two things: history of the rash and the visual exam of the rash. So the history of the rash contributes 10 to 20% of the diagnosis come from the history of the rash, and 80 to 90% of the diagnosis come from the visual examination of the rash. So the history of the rash is what's causing the rash, the incubation period of the rash, and how rash is evolving over time. The visual exam of the rash is looking at the rash, checking the rash visually, and comparing signs and symptoms of the rash. Now we're going to talk about history of the rash and the visual exam of the rash in more details, so we can understand the difference between genital herpes and vaginal yeast infection. Now we will talk in more details on the history of the rash. The history of the rash is what's causing the rash. It's part of the history. And since we're talking about the genital herpes and vaginal yeast infection, obviously sexual contact is one of the possibilities that can cause both conditions. But for the yeast infection, a lot more reasons available, and people usually remember having antibiotic for a prolonged time, or just strong antibiotic and then use it. Birth control pill, if they just started taking birth control pill, especially with high estrogen level, can cause yeast infection. A lot more reason for the yeast infection, and not a lot of reason for the herpes. It's usually skin-to-skin contact. Incubation period is another thing which is part of the history of the rash. And incubation period is 1 to 3 days for both conditions, and it's not major differentiating factors between those two conditions. Now we're going to talk about the most important part of the history of the rash, is how the rash is evolving, how the disease is progressing for both conditions. So both vaginal yeast infection and genital herpes start as a itch, mild itch and burning sensation of the area. And for the yeast infection, that burning and the itch usually persist and get very intense as the disease progresses. People start noticing the redness and the swelling of the vulva and the vagina, and eventually they start seeing the whitish discharge, and the area stay itchy all the time, and it burns a lot as well. For herpes, the initial burning and initial mild itch usually turns into the pain, and the area become red, the area become bumpy, the bump's gonna turn into the blisters, it evolves over time. The roof of the blisters comes off. Person gonna end up having open sores, and those sores usually heal without leaving any scarring. So the herpes lesions go from one stage to another gradually, and during the entire time, significant pain usually noticed. So again, for the herpes, the initial itch turns into the pain. For the fungal infection, which is a yeast infection, which is part of the fungal infection, it usually stays itchy and stays burny, and usually it even intensifies. Two other things, which is part of the history of the rash, that only related to the herpes, and yeast infection, vaginal yeast infection, does not have those. And I'm talking about the prodrome period. It's a prodrome that precedes the rash appearance. And usually we call them non-systemic, non-specific, systemic symptoms. We call them non-specific because other conditions can give you the same symptoms. Other conditions such as flu, COVID, any other viral infection, even sinus infection, can give you the same symptoms of fatigue, muscle aches, fever, chills. So those symptoms called prodrome, and they can precede the rash appearance for the herpes. In addition to the prodrome period, people with herpes infection can have tingling sensation in the area, and it's usually on the side of the rash. And the reason for the tingling sensation is when herpes enters the skin, it usually gets into the nerve and stay dormant in the nerves locally for the rest of your life. That's why people usually have tingly feeling of those nerves. And people with yeast infection, vaginal yeast infection again, do not have prodrome period and do not remember having tingly feeling in the region. Now we're going to talk about the visual exam for both conditions. We're going to compare, when we compare herpes to yeast infection side by side, you can see significant difference. So 80 to 90% of the diagnosis come from the visual exam of the area. So when we look at the person, when we're examining the person with the yeast infection, you can notice a significant redness and swelling of the entire area. The entire area I'm referring to is a vulva and the vagina. You can see significant redness, swelling, and person usually mention a lot of itch and burning of the area. And you can see a lot of discharge. And the discharge consistency is usually cottage cheese. It's very thick discharge and abundance of that discharge, a lot of discharge. When we check the person with the herpes, and as I said earlier, the herpes usually goes from one stage to the other. The lesion for the herpes evolves over time. People usually can have redness first, then bumps, then blisters, then sores. So we can, when we're examining the person, we can see the person during different stages. But regardless of the herpes stage, when we're examining the person, you can see usually those bumps, blisters, or sores clustered together, usually on one side. You can usually see minimal swelling. It's a minimal swelling, but a lot of pain. A lot of pain with minimal swelling. Usually clustered together, usually on one side. Yes, it can be widespread, but it's usually one-sided. People with herpes can even have a discharge, but the discharge for the herpes is usually very transparent. Very thin and transparent discharge, clear discharge, and it's usually within very short period of a time when blister turning into the sore. So the fluid comes out and you can see very watery, minimal discharge, not significant amount. The biggest difference between herpes and yeast infection is presence of enlarged lymph nodes on the side of the source for the herpes. So when people have herpes lesion, if it's one-sided, and it's usually one-sided, on that side of the side of the body, locally, only in the area, people usually have painful and big lymph nodes. For the yeast infection, unlike herpes, it's not a systemic condition and lymph nodes usually not enlarged. So this is a conclusion of the video. And if it was helpful, I'm going to ask you to click like, and we're going to be grateful if you're going to support our channel by subscribing to our channel. And we're going to be posting new videos very soon. Thank you.